How's it going? I'm Andrew McElroy. I'm one of the chief residents. I'm a PGY4 here at Stony Brook. Along with me is Dr. Gray, so she can say hello.
Hi, everybody. I'm the program director. I've been in this role for about 5 years at Stony Brook. I'm also a former resident of the program, so I have a little bit of an interesting perspective on things. And Andrew is going to kind of take things away, and we'll both answer whatever questions after the presentation.
So first off, just a little bit about myself. I was born and raised in southern New Jersey, went to school at West Virginia University, went to medical school down at St. George's, did my intern year in Long Island, and I'm still at Stony Brook here, and I've loved every second of it. So now I'm going to play a PowerPoint for everyone. And I hope everyone can see this. So this is our residency. So this is Stony Brook, and we have 3 locations at Stony Brook University, at the VA, and at St. Charles Hospital. So you just met Dr. Jennifer Gray, who is our program director. The site director at the VA is Sergio Lombardo, and our program coordinator is Dennis Loney. So as I said, these are our 3 institutions right here: the St. Charles Hospital, Northport VA, and Stony Brook. So a little history of our program. Our program was founded in 1997. The first graduated class was in 2000, and we've had 20 classes that have graduated since then. We are fully AC GME accredited, and then we are a 3-year program. We have 9 residents total in the program, and that makes up 3 residents per year. So I'm going to first talk about St. Charles Hospital. So this is our main rehabilitation center. It was founded over 100 years ago by the Daughters of Wisdom and began as a hospital for children with disabilities. Since then, it has expanded into a full-service hospital in the 1960s. We are a greater than 50-bed rehabilitation service, and it's a full service hospital. The Department of PM&R is the largest department in our hospital. For the VA, so this is where we do most of our EMG rotations, and we do 12 months there total. So the VA, it's 4 months a year, and it's our large exposure to EMG and outpatient clinics. So this is an outpatient clinic only at the Northport VA. So this is where we do get most of our numbers. The average resident will graduate with approximately 240 to 250 EMG studies. At the VA, we'll also do intra-articular injections. We do Botox injection and peripheral nerve blocks. We do trigger point injections, tendon sheath injections, and arthrocentesis. We have acupuncture exposure and also ultrasound guided injections. So this is something that I feel like does make our program stand out. And there are other programs with VA exposure around the country, but I do believe that the VA is very important because you are doing the procedures. These are hands-on procedures where you learn how to do things, doing these ultrasound guided injections, Botox, you're thrown in there, PGY 2-year, you're doing a lot of Botox for migraines, and then PGY 3 and PGY 4-year, you'll be doing Botox for spasticity, as well as some other things. The ultrasound guided injections, we do get good numbers there. We have a whole day set aside to do these ultrasound guided injections for many different causes. And we're doing ultrasound, both diagnostic and therapeutic injections. And then for the Stony Brook, so we have an EMG rotation. And then we also have our interventional spine/pain rotation, where we'll be doing procedures like epidural blocks, facet and medial branch blocks, vertebroplasty, kyphoplasty. We'll be watching spinal cord stimulators, intrathecal pumps, mild procedures, and again, ultrasound guided injections. And then so the pain rotation is a 2-month long rotation, your PGY 3-year. And the EMG rotation is a 2-month long rotation in our PGY 4-year. So both these rotations, you also do have an option to do your PGY 4-year during an elective. So what we give to the incoming residents. So you get 2 textbooks. These are on us. We give you the Preston and Shapiro EMG book, which is a very good book and very helpful when learning how to teach and do EMGs. And then also the John Jacobson's Fundamentals of Musculoskeletal Ultrasound. So this is basically the beginner's book for both diagnostic and therapeutic injections with the use of ultrasound, and is a very good book at the beginner level. We give a membership to both AA, PM&R, and AAP, and the subscription to the respective journals. We also provide the board review course at Kessler, which this is for the PGY4 residents to prepare them for their boards that they will be taking at the end of that year. This is a week-long course, and senior residents are not charged vacation time for this, and so it's a nice course for them basically to get ready for their upcoming exam. During the PGY3 year, we provide an anatomy lab course. This is at the Toro College, where 1 day a week in the afternoons, all the PGY3s go to the anatomy lab, and basically they're following an anatomy instructor and going over all the muscles, nerves of the body. And it's a very good course. It's very helpful, and it will help you out along the way. And we do get stipends for both regional and national annual meetings if you present a paper or a poster. So this is an incentive not only to do research and present a poster, but so you can go to the meeting and they compensate you for a decent amount of the meeting, and it's very nice. So these are our salary and benefits from 2019, 2020. So this is not updated as of yet, but being in Long Island, we stay very competitive, and I think this is pretty good compared to the rest of the country. And we will help you find a place to live. People do live in different areas because the VA is in Northport, which is about 30 minutes from Stony Brook. And then St. Charles is in Port Jefferson, which is about 10 minutes from Stony Brook. So people tend to live in different places in Long Island. I actually live out by the VA. So when I commute to the VA, my commute's very short. And when I commute to Stony Brook or St. Charles, I have a little longer commute, but it's something you get very used to. And it's really not that bad. And I'm not going down on highly trafficked roads. So the call schedule. You only take call when you're at St. Charles. So that's 8 months of the year, both PGY2, PGY3, PGY4. Call is at St. Charles. It's from 5 p.m. to 7 p.m. And basically what you're doing is all the admissions for that day. The PA will cover the floors from 7 p.m. to 7 a.m. So you're not responsible for any of the patients after 7 p.m. You're just responsible for the patients that you admitted. As a PGY2, you'll do 6 calls per month. As a PGY3, you'll do 5 calls per month. And a PGY4, you'll do 4 calls per month. And that's no weekends. So as a PGY4, you have every single weekend off the whole year. And as a PGY2 and a PGY3, you have every single weekend off while you're at the VA. So no matter what, you at least have 4 months of no weekends off every year. And then as a PGY2 and a PGY3, you work 1 Friday, 1 Saturday, 1 Sunday a month. That's how that is broken down. So vacation time, you get 4 weeks of vacation per year. And then when you're a PGY4, you get 7 interview days that you can take for either fellowships or job interviews. And then you also, as I said earlier, you have the board review course, which is not charged against your vacation time for the senior residents. And the vacation time is broken down. As a PGY2, you have 4 one-week vacations. As a PGY3, you have 3 one-week vacation blocks, and then you have 5 solo days that you can take at any time. And as a PGY4, you can take 20 days, basically whenever you want. So as a PGY4, it gets to be pretty nice. So as our rotations go, so we have 12 months of adult inpatient. As most programs are, you do most of your inpatient your first year as a PGY2. This covers neuro rehab, ortho, trauma, amputee, stroke, and this all takes place at St. Charles. Then you have 2 months of peds in the inpatient outpatient setting, and then 2 months of outpatient, which consists of MSK, neuro rehab, spasticity management, and you'll also be doing EMGs. So this is all at St. Charles. For the adult inpatient, of those 12 months, 8 months of that is in your PGY2 year. So your PGY2 year is made up of 8 months on adult inpatient, 4 months at the VA. Those last 4 months of adult inpatient come in your PGY4 year, where you're doing 2 months as a senior on the inpatient service and 2 months with our neuro rehab doctors going over stroke and TBI patients. The 2 months of peds and the 2 months of outpatient are in your PGY3 year. At the VA, as I said earlier, you have 4 months per year in outpatient. And this is where you're doing the EMGs, injections, Botox, MSK, ultrasound, orthotics and prosthetics. You'll see general PM&R outpatient patients, and we also have a wheelchair clinic. So then we have the interventional spine/pain rotation. That's a 2-month block that you'll do your PGY3 year, and also have elective possibility if you would like to do it PGY4 year. And then 2 months of neuromuscular/EMG, or PGY4 year, and you can also do an elective in that if you would like. So you have 2 months of electives slash selective in PGY3 and PGY4, and they can be at various locations. A lot of our colleagues do our sports rotation, the PGY3 year as part of this elective. We do radiology rotations, MSK radiology. People do OMM. You can do SCI. There's a lot of things that people have done throughout the years. You can do rheumatology. So it's really up to you. And you can also go to other places, and you have 2 weeks that you can spend at other facilities, and if it's approved to do a rotation. So our didactic lecture schedule. So it's a 3-year curriculum, and it's designed with attention to the AB PM&R. So basically their specifications. These lectures are held on Monday and Thursday afternoons. They're from 1:30 to 4, and this is protected time for the residents. So whether you're at the VA or St. Charles, inpatient, outpatient, it doesn't matter. This is your time, and you can do with it. So no one's going to bother you during these times. We do have people from all over Stony Brook come and give us lectures, different, and I think next slide. So this is the module that what we cover annually. We start with the intro to PM&R, which is basically anatomy, kinesiology, and neurophysiology. We go over neuromuscular medicine with the EMG stuff, spinal cord injury, stroke, TBI, rheumatology, pain, palliative care, basically every chapter that you'll see in Cucurilla. And we'll have people from all over Stony Brook and all over Long Island come and lecture us. And there are very good lectures. And so what else we'll do with our didactic time? So monthly we'll have Dr. Lombardo, who is the program director at the VA. He gives us ultrasound workshop. So 1 month we'll do shoulder, 1 month we'll do hip, ankle, knee, wrist, and we'll basically be going over basic to more advanced levels of ultrasound, depending if you're a PGY2, PGY3, PGY4. We have journal club. We also go over board review questions for each area and for each block that we go over for our didactics. We have a resident roundtable for each area as well. And then we also review research and QI projects. And with the QI projects, I think this is something that stands out about our program is because we do put a strong emphasis on everyone to get their QI projects done. And I know as a medical student right now, you might be thinking, well, why do I want to do a QI project? But what it does for you is everyone's going to have to do a QI project within the first 5 years as an attending. So if you do that as a resident, it counts. So when you're trying to start your practice or whatever you're doing at that point, you don't have to worry about doing this QI project. And we try to make sure that every resident gets through the program with a QI project published.
You guys have 5 minutes.
All right, thank you. So these are some of the research projects. I'm going to try to speed through this a little bit quicker just because I want to get to questions at the end. But these are, you can read through this. These are some of the projects that we're doing right now. Some of our recent publications. Again, some more recent publications. And then, so what our former residents are doing now. A lot of residents do go into private practice. And then many of our residents do enter fellowships. We have placed a lot of people in pain. I myself, I'm in the process of applying for pain right now. One of my other colleagues, she is in the process of applying for pain as well. Then other people have gone to neuromuscular medicine fellowships, cancer rehabilitation fellowships, and sports medicine fellowships. What I can say is that the pain doctors that we do work with, he is one of the most, he's known throughout the country. And on my pain interviews, I would talk to the pain program directors about things that I did with, his name's Dr. Durkin, and there were program directors that didn't even know some of the procedures that we were doing. Just like he is on the cutting edge of all the procedures, and we definitely place people very well. So just because we don't have in-house fellowships doesn't mean that we don't place residents into very, very good fellowships. We definitely do. We have very, very good people to work with, and we do very well with getting placed into fellowships. So again, my name is Andrew McElroy, and if you have any questions, you can feel free to email me. This is what I'm here for, and ready to answer your questions. So I can take this. So basically they're asking about sports coverage and community outreach opportunities. We do have opportunities with Stony Brook. So I myself have done things because I was interested in that. Working with Stony Brook through sports, I got to go and do like sports physicals for the lacrosse team, for the girls volleyball team. You can also go to all sporting events. The only sporting event that's hard, which I know most people want to do, is football. So with that, you really have to get in touch early because that's an NCAA rule where you can only go on the field. You can only have so many people on the field. But with other community outreach opportunities, I went and worked for high school football teams. You can be on the sideline as the doctor. There are a lot of things that we can do. I'm assuming my time's running out. Is that why?
You guys have 2 minutes.
2 minutes. All right. But yeah, there are, I don't know, Dr. Gray, if you have anything else that you like to add?
Yeah, well, right now sports coverage is kind of there because of COVID. Yeah. Probably for everyone across the country. So, but that, in sports coverage, it's, if you really want to do it, there are definitely opportunities out there for you.
Anything else?
Well, so there's a question about leadership opportunities. There are leadership opportunities through several committees at Stony Brook, even for residents to join, like the Wellness Committee at Stony Brook, and there's a diversity committee. There's a lot of different committees that residents can be involved with as well, and they welcome resident involvement in those committees. Our residents are involved in the patient safety committee there.
Again, I'll leave my email in this text box if you guys did not get that. Again, feel free to email me at any time. Even if it's if it's about our program or even about just applying in general, I'll be very honest with you. You know, I wish the best of luck to all you guys. You know, I know it's a tough time right now, especially with COVID and everything being pushed back, but good luck to you all, and I wish you the best.
Awesome. Dr. Gray and Dr. McElroy, thank you so much for your
Thanks,
time.
everybody. Have a good night.
Thank you guys so much for your time. It was a great presentation.